it's wonderful to have you. You guys are all leaving in the next day or two. And that means we have to fend for ourselves. So the newspaper is going to have articles. I don't know what their source is, but you know, our newspapers here are, you know, they're mainstream newspapers. Our doctors all were educated, and I'm not sure who decided on what they learned in med school. I don't know if the medical industry was involved in their curriculum. We're told, I don't know if the clinical trials are accurate or not, I'm not sure. I don't know if university information is accurate. I don't know if the CDC, FDA, USDA are giving me accurate information. When someone says it's scientific research, I don't know if it's accurate. So most people do believe that the newspaper and the med doctors and the clinical trials and the universities and the CDC are pretty much accurate. I'm not so sure now. I mean, you know, the more we learn, the more I realize that it seems like there's a financial interest influencing all of these things. What's your thoughts? I mean, what should we feel comfortable and trust and feel good about? And what should we be very weary and feel like they're giving an answer that there was someone used their financial influence to influence these things? So what should we listen to? What should we believe? How should we think after you leave about?
I'll start. Well, first of all, some of the agencies that you mentioned, you know, one of the laws that was passed by our illustrious Congress in 1992 allows the drug companies to fund the FDA. Last year, the drug companies paid the FDA $787 million and change, and the approval rate for drugs was 96%. So I would love to see the 4% they turned down. It must be like intravenous arsenic, and there was probably a conversation in the hallway. We wanted to approve it all, but we got to look like we're paying attention, so submit it next year, you know. And there are some good people who work at the FDA, by the way. We had a physician take our physician training course because she wanted to do better. So what we have is good apples in a bad barrel, if that makes any sense. A lot of good apples and a lot of bad barrels. So here's what I tell the folks who come to us for information. The first thing is, make it your job to learn how to read research. I teach a course, I'm teaching a course in that to lay people. I've taught health professionals how to do this for a long time, but I can teach lay people how to do it too. So you learn how to read this information so that you can start to make decisions for yourself. The second thing is you have to get grounded in a philosophy, and then it's not that you're not open to new information, but you're not floating in the breeze that every time you hear something new or you see a headline in the newspaper, you're jumping off the cliff on another tangent to some other crazy diet or some magical supplement or whatever. The third thing is that a guy by the name of Dr. Karl Popper, not a relation of mine, by the way, he was living in London at the time, and he said one of the problems with people is that what you should do is when you hear a new idea is try to prove it wrong. And if it's right, it'll persevere, and if it's wrong, you'll let go of it. And people do the opposite. They hear a new idea, assume it's right, and then get attached to it and almost, you know, fervent about hanging on to it, reluctance to give it up. And I think we need to change that so that, I guess the best thing I could tell you is that a lot of what you see and read, if not most of it, is wrong. Assume that it is until proven otherwise. And I think you'll save yourself from a lot of grief.
That's very well said. I do, you know, with all of due respect to our industry colleagues, we do have worries about they are not always going to be on our side. They have a fiduciary responsibility to their shareholders and not necessarily to science. But having said that, there's a lot of good science that does go and a lot of information that we are able to get, and there's ways of making money out of excellent science. So we don't want to throw it all under the bus. But I would say that we have a responsibility, as Dr. Popper was saying, we all have a responsibility to learn and to go in with the humility. When they say that medical knowledge doubles every 2 years, if that's still true, it's probably even faster now, then we have to be willing to to have a little bit of whiplash and, you know, be ready to turn 180 degrees on things that we knew last year, which we find out are no longer true. And so I think that's the approach that we have to have.
I get asked that question, Steve, so often. You know, how, for somebody in the public, how do we interpret whether or not something is true or not? They're reading this, that, and everything else. And in the area of nutrition, this has been a particular problem because we got lots and lots of nutrients, lots and lots of things we can claim, a lot of discoveries, you know, grows, it multiplies every 2 years, whatever it is. We have such an enormous amount of information, and it got me to thinking, too, that not only is it not possible for the public to really interpret the validity of some of this information, but there's something a little deeper than this, and that is the fact that we are so reductionist in our thinking. You know, we do it in research, we do it in practice, and we think about the details. We think about the details so much, and the obvious opportunity for controversy is endless when we take that approach. And so, and I call that essentially technology. That's not necessarily science. I'm being a little bit hard on that, but there's a bigger message here, especially regarding the whole food plant-based diet, that we should pay attention to. We should not get caught in the weeds and talk about so much about the details, and pay a little more attention to the more comprehensive effect of, let's say, this total diet, how it works, what kind of endpoints it creates, and that sort of thing. And I like the word holism, as I mentioned in my lecture, and I think I hope, I'm really impressed with the way the cell works when you think about that concept, how everything works together. It's fantastic. It's nature at work, and somehow we've gotten in the business of being technologists instead of scientists. We're always looking for an easy answer, you know, this, that. The opportunity for controversy is just enormous. And so I don't actually think we can hope ever to train people who are not in the field to really be able to interpret whether something's valid or not valid. I think there just needs to be this recognition that a lot of claims will be made. They do make newspapers. If they make money, they make a lot of news. And that's just the way it is. And I think we need to back off and look at the bigger picture because there's so much to offer. And the whole food plant-based diet with these innumerable numbers of agents that act as causes, all these mechanisms, so forth. You know, nature's a beautiful thing. You know, the default position of the cell is to create health. You stop and think about it. The default position of the cell and the body is to create health. And so we do things to ourselves that's not in the best interest of the body. We do it all the time. The body's always struggling to regain that homeostasis, that sort of comfortable place to create life and health. And so I think we need to spend more time thinking about the big question, whole food plant-based diets. This is not a magic pill. It's just that it has this very broad sweep of effects, and just sort of back off and marvel a bit at nature, what it can do. And don't be so anxious to jump in there with the latest fad, do this, that, or something else. Just let nature play its course. And so that's one of the reasons I like that holistic idea. And then not worry too much about it. Just be aware. If we see, I think you said, one of you said something about when something new comes out, we need to test it, we need to screen it, we have to prove it wrong. That's a fundamental concept of science, really. You know, trying to falsify hypotheses. That's classic. And so I totally agree with that approach. And so just let some of the rest of it pass by.
Well, this has been great. I mean, it's so exciting to have an engaged audience like you folks have been. When I started surgery, when I came back from Vietnam, I was offered a position as a general surgeon at the Cleveland Clinic. Probably one of the most frequent operations I was asked to do was for peptic ulcer. And as Kim Williams has pointed out tonight, when these crazy Australians, was it Warren and Matthews or something like that? I have not got it right, but they... Marshall. There you go. You're doing your homework. Was it Warren? Was it Warren and Marshall? Is that right? Yeah, it was two. Well, they kept saying that they could find these little bacteria in these gastric specimens. And of course we said, look, you guys are from down under, you just don't seem to get it. No organisms are going to live in intense normal hydrochloric acid, but they were right. They were right, and the whole field. I wasn't the only one doing surgery for peptic ulcer disease. I mean, this was the mother lode for surgeons. That's where they made a fortune doing all these operations. destroying the gastrointestinal tract, doing vagotomy, gastrectomy, partial gastrectomy, pyloroplasty, and it was gone. It absolutely suddenly was gone. Here is the mother lode for surgeons, and it's gone. Well, you know, this is gonna happen. Believe it or not, it's gonna be harder with something like cardiovascular disease and these other common illnesses because so many other embedded areas are conflicted. But it is going to happen. And one of the things that strikes me as very interesting, you've always heard me say that what was going to move this forward is not the hype and the snake oil. What it's going to be is the science. And just recently, I've been involved with charming a certain benefactor who has now funded the Journal of Disease Reversal, which will be a marvelous invitation to people to get those studies in there, whether it's not only with vascular, but also all the other ones that we've been talking about tonight as well will be invited. And that will really, hopefully, begin to push the rock up the hill a lot faster. Thank you.
Okay, if you would like to ask we have time for a very few questions that I can call on a few people. So raise your hand if you would like to ask a question. That lady right there, okay, please give her the microphone.
First, I'd like to thank you all for being here. I want to thank Dr. Esselstyn and Dr. Campbell, Dr. Williams, and Dr. Popper. My question is for Dr. Popper. Dr. Popper, you spoke about the flu shot. Well, this is something really personal, and I really need a lot of help with that. Recently, I used to work for NYU Winthrop in December, this past December, and I was told that if I don't get the flu shot, I'm going to be terminated. So I was terminated because I didn't get the flu shot. Not only was I terminated, but I'm not allowed to get my unemployment. And so now I have to have a hearing to try to battle with them to try to get some unemployment while I'm looking for a job.
Okay, I have some, can I start?
Please.
I start you there? Okay. The first thing is that there are lawsuits being filed against medical institutions for not allowing people to use the religious exemption for flu. The Equal Employment Opportunity Commission has gotten involved in these, and they've managed, and some of them are getting settled out of court because the institutions know they're going to lose. So the first thing I would tell you is contact the EEOC and see if they will file a lawsuit on your behalf. They're doing a bunch of them right now. The second thing is that the Trump administration set up a division in Health and Human Services to, and I can't remember the name of this, but if you will send me an email, I'll send you the information. I filmed a video clip about it, so you'll hear about this next week, those of you who are going to be on my video clips list. Anyway, the bottom line is that this is to make sure that people do not have to go against their religious beliefs to perform abortion or assisted suicide, et cetera. But the portal, I went to the portal where you file the complaint. It invites anybody who has been unable to use religious exemption in a medical setting to file a complaint. And I put on my video clip, which you'll see next week, that we need to flood the system. We need to flood the system. The other thing is we have a law pending in Ohio to make the mandate illegal. And we got it out of committee, and the drug companies did a switcheroo and got it back into committee. Long story about this because there's a lot of money in these vaccines. But the bottom line is that see if you can start a movement to get the law changed in New York, because there's a growing list or group of dissenters who are interested in doing something, who are quite active. But I would file a complaint and call EEOC and see if you can file a lawsuit.
Thank you very, very much.
Hi. They didn't go so much into the chia seeds and all that, like which I use a lot. Is it necessary to take EPA and DHA, or can you get enough? Because I don't use fish and all that. And how much chia seeds or hemp seed, assuming we're not using regular oil, how much of that is healthier and how much isn't, because I'm totally confused at this point. Thank you.
Do you want to take it? Do you want to?
Is it, your question is whether you're getting enough omega-3? Yes. Is that right? First of all, you're going to get lots of omega-3 in plant-based nutrition, and there's plenty of omega-3 in green leafy vegetables, and you heard how often it's kind of nice to have those.
Right.
And and I ask my patients to take a couple of tablespoons of either flaxseed meal or chia seeds, which, yeah, and you can always have your omega-3 level checked, and if you're normal, you're fine.
Okay.
If you're still a little bit low, just increase your intake.
Okay, thank you.
One other thing I'll mention is vegans and vegetarians tend to have lower DHA levels, but it's never been linked to any disadvantage. In other words, the observation that somebody's numbers are slightly low doesn't necessarily mean that that person is sick. And so you see a lot of the justification for supplementation is, oh, the vegans are low. Well, show me some evidence that the vegans are sick because they have lower DHA levels, and then I'll start worrying about it a whole lot more.
There's an underlying thing here too, I think most of us know about, and that is this ratio of the 6s to the 3s that really matter. And when in fact we're using a whole food plant-based diet, low in fat, low in total fat is another factor that it comes into play. When we're low in the fat, total fat, and total whole food plant-based diet, then we're at a ratio of something like 1:1, 2:1, omega-6 to 3. That's apparently ideal, it appears to be. But actually, in the population at large, I see various numbers, but it's something like 15:1 to 20:1. I see these kind of figures for omega-6 to omega-3. So we, quite frankly, are living on a fairly pro-inflammatory type diet and also high-fat diet. So the combination of high fat, lots of added oil, usually omega-6, we're really out of whack. And under those circumstances, then omega-3, one can maybe make a reasonable argument, to take some 3s or whatever it is, or whatever it is to kind of rebalance things. But we don't need to be there. And as I say, if we're doing the right thing, then everything falls into place. And so it's a different ball game, it seems to be, before we recommend that.
Well, and to your point, there have been a lot of meta-analyses that have looked at the benefits of taking omega-3 type supplements to reduce the risk of anything. And you find these little studies out there that show a little bit of benefit, but it completely gets wiped out in the meta-analysis. And I think what the message is, the take-home point, is that an omega-3 pill is not going to make up for your dietary indiscretions. So really you want to get the omega-6s down. That's really the only way to deal with this if your actual goal is health improvement. It's not to try to take in enough omega-3 to get the ratio right with the continued intake of omega-6.
This lady right here.
Hi. In listening to you all, and I do believe in just about everything you said, but over the years, so many things have been said that, eggs were good, then they're not good, then the fatty fish is good, then it's not good. How do we know, and how do we know for sure? I'm just a little afraid to go so extreme, if that's the right word. How do we know that come tomorrow, something is going to come out that a little bit of red meat or a little bit of oil is healthier in the long run? Thank you.
That question really comes back to my point about reductionist science, worrying too much about the details. Really, I almost let that pass by. We don't need to be that precise trying to figure it out, because we might be an individual who doesn't respond that way anyhow compared to someone else. So I wouldn't, I know it's a cop-out, sounds like a cop-out, but in reality, those kind of detailed questions seem to me not to be worth the attention that they seem to get. I'm sorry about that, but that's...
Yeah, I would concur with Colin, because you're just going to get yourself so tied up in knots, worrying about this reductionism we're talking about. To make an example, let me make it simple as I can. When Bill Connor, the late Bill Connor, when he went down to northern Mexico and he studied 583 Tarahumara Indians and drew their blood, first of all, none of them, not one, was overweight. 2, not one had hypertension, and none had any nutritional deficiencies. And what did the Tarahumara eat? The 3 sisters: beans, corn, and squash. Pretty simple. I hope that answers your question. Keep it simple.
So, well, maybe I could just rephrase your question for a moment. That is, when do you take the level of evidence as high enough to actually change your own behavior? And I would say that opinions are really probably, if they're isolated opinions that are really not based on any science, we would take them not at all. When you have observational trials that are published, and a lot of the things that I talk about are observational trials because we don't have anything else, then you can put some weight on it, but you'd feel more comfortable if there were multiple trials that all said the same thing. When you put those together, like the Omega3 analysis that was done, really just published the last couple of weeks, saying that, yeah, it's pretty much worthless. That was adding up a massive amount of data, some randomized, some observational, but mostly randomized. Well, when randomized trials, meaning that somebody gets a fake pill and the other person gets the real pill, or in case of diet, it's a little tough to do placebo controls. But the idea is that if you do a randomized trial that lasts a very long time, so that you have hard endpoints, not, oh yeah, your LDL cholesterol went down 10 points, but no, you had less heart attack, stroke, and death, and large numbers, then you can feel comfortable that that level of evidence is something that really should be game-changing in how we approach patient care or our own habits. And so I really would pay attention to not just what people say, but the hardness, the crispness of the evidence.
One thing that, this goes back to something I said earlier, which is I think that we spend a lot of time on this type of education in our office because people have to be grounded in this philosophy. Not grounded in it because of what I say. Doing what I say isn't taking control of your health. You've just substituted one person telling you what to do for another person telling you what to do, and that's how people end up in my office. I'm a busy girl every afternoon I show up for work because people have been following directions without knowing what they should be choosing and looking at all the evidence. So I think the first step is you've got to learn how to look at this and understand the evidence enough to be pretty grounded. Again, like I said, not so that you're closed-minded to anything, but you're not so willing to shift with the breeze. The other thing is that I got an interesting email this week from somebody who said, you know, you've been posting those video clips for, gosh, it's probably 6 or 7 years now. Are there any that you should take off because they're outdated? And I said, no. And the reason is this. New in the research field can be better. When we find out new things, it's exciting. But new doesn't necessarily mean better. All right? There's a lot of junk that comes out that's new. And so a good example of stuff that we've known a lot of this stuff, I mean, you were the one who, the first lecture I ever listened to on protein, Dr. Campbell, was yours. Going back to over 100 years ago, we knew that high protein diets were bad. Okay, so we've known for over 100 years that those diets are bad. The new stuff, new about protein, really isn't all that good. For the studies are highly flawed, but they don't really change the 100 years of evidence that we have. And so I think that I wouldn't confuse new with quality, I guess is what I'm saying. You really have to look at these studies, who did them, does this really change the prevailing thought, or is this an outlier kind of thing sponsored by industry designed to show that eggs are good for you when they're really not? By the way, the Egg Board manipulated all of that. I don't know if you guys know this, but they started doing studies after the government decided that we're not going to fund research on cholesterol and smoking because we basically knew all that we needed to know. Bad for you, smoking and eating cholesterol. Well, the Egg Board looked at that and said, this is our opportunity. So they started doing their own studies, and what they were doing was adding eggs to people's diets who are already consuming like 500 or 600 or 700 milligrams of cholesterol a day. You don't see much change, right? So they reported, you know, it's not harmful to eat eggs because people ate extra eggs and their cholesterol didn't go up. Well, then what they did is they did a meta-analysis of all of their studies. The inclusion criteria was the research that they had done. The cutoff point was the date when they started doing research, which eliminated all the government research that showed that eating cholesterol is bad for you and pronounced that all the new research shows that cholesterol is safe to consume. So that's why you have to be careful of new. There's a lot of manipulation to report a result that an industry, a particular industry, wants you to believe.
If you would each like to take 1 minute and give any final thoughts or any closing statement or any final thing you want to leave us with.
I'll go first. So I guess my final statement is thank you, Steve Shore. You rock.
I'd just like to say I'm glad you're here. We need more. We need more of you. Okay. You know, if you look at what's, we've talked about a lot of issues in healthcare. We've mentioned the expense. You know, if you think about what we're spending on healthcare, well, it's sick care, right? If we think about what we're spending on it, and instead of college education for poor people or roads and bridges, there's so many other things we could do with that money. That I think that we should tell all of our friends and family that it's their patriotic duty to become a vegan.
You missed my talk today. Vegan, I don't use that word because vegan fat content and sugar content, vegan diets is equal to that of meat eaters, by the way. It really is the biggest survey so far, 10 keys has worked. No, I would echo what Dr. Williams and Dr. Popper said, that it's fantastic to talk to a group like this. Obviously, very enthusiastic, very informed, I think, group as well. And when we're in the weeds, involved in institutional issues and problems, being either part of institutions and so government, academia, whatever it happens to be, it gets a little bit troublesome and tiresome at times. And the only way that I can see everything happening in the future is exactly this kind of thing right here. You folks getting together, showing some interest, and really getting involved, because that's the only way I think that's going to work is from the ground up. So it's been a fantastic delight for me to actually be in the presence of these kind of colleagues and you as participants. Thank you.
Well, it's interesting when you try to get your arms around science as an audience, and I just would, although we hear a lot about randomized trials, there's an interesting history in medicine. When Jonathan Snow took the handle off the Broad Street pump because of the cholera epidemic, he had found out that the sewage intake was coming in upstream from the pump, took the handle off the pump, and the epidemic went away. Not a randomized trial. Along came Morton and invented ether, not a randomized trial. Then along came a guy named Semmelweis, Theodore Koch, and Pasteur and Lister. No randomized trial. Learned all about the bacterial importance of illness. Then along come Banting and Best. We discovered insulin. Alexander Fleming and Florey, penicillin. And then again, in the back of the room, the second name for the people that discovered peptic ulcer, Helicobacter, doctor, what? Warren and Marshall, that's it. God, I got to write that down. So it's, I think you're a very acquisitive audience, and there's going to be other things that come along. And there was a Nobel laureate who was a physicist who made the following observation that I think is key, he said, in the scientific method is what? We propose a theory, and then we do the experiment. The experiment is either right or it is wrong. It does not depend upon the wealth of the investigator, the personality, how persuasive they are. It is either right or it is wrong. You are a wonderfully sophisticated audience, and it's such an honor for me to be here with you. And I wish you all exciting days ahead in your plant-based world. Thank you.